So again, I come back to
but that's not waste, fraud, and abuse.
Prosecute the fraud.
That's not waste, fraud, and abuse.
Just finish one point here.
Go ahead.
Well, a lot of it is waste, fraud, and abuse. I think about 10% of that is waste, fraud, and abuse. If you look at the Daily Wire's reporting,
I can tell you what 2 out of 3 of it is.
Chris Cuomo had Vivek Ramaswamy on his News Nation show, and the topic on the table is one of MAGA's favorite buzzwords right now: waste, fraud, and abuse, specifically in Medicare and Medicaid. Now, Vivek is running for governor of Ohio, and he is trying to sell the idea that if you just crack down on fraud in Medicaid, you can save billions, cut costs, and fix the whole system. Chris Cuomo pushed back, and I have to say, he made some very sharp points, but I have thoughts of my own that I want to add on top of this. Let's watch the full clip together, and I will break it all down on the other side.
Healthcare. It's become a boogeyman in too many families, cost structures, and they're nightmares in this country, okay? It is a top priority for all of us. It's getting no attention. None. It's completely distracted from. Congress isn't touching it. The president had talked a big game about bringing in the healthcare bigs. I thought it was a great idea. It never happened. But on the state level, you're seeing a lot of things happen. And there is an interesting push on the right that the key to change is waste, fraud, and abuse. I am very suspicious of that. Not that there's waste, fraud, and abuse. Of course there is. But that it's of an amount that is actually determinative of the outcome of the program, especially when it comes to something like Medicaid. Now, in the Ohio race for governor, healthcare is going to matter. They have big problems in that state, okay? Vivek Ramaswamy, you remember him from DOJ, right, and helping with the Trump administration. He says he thinks that the answer to Medicaid is exactly what I'm discounting, which is waste, fraud, and abuse. If you take care of that, it's going to be billions in savings, and it's going to save the program. It's going to give money back to Washington. It's going to be great. In the Wall Street Journal op-ed, Vivek argues that states should be allowed to keep more of the money they recover from Medicaid fraud, giving governors and state agencies a real financial incentive to aggressively investigate and then prosecute abuse, and then reinvest those savings back into healthcare. So let's discuss how this would work. Joining me now is gubernatorial candidate Vivek Ramaswamy. Can you hear me?
Yes. Good to see you, Chris. How you doing?
All right, good. I know we have some comms issues. Let me know, Vivek, if they're a problem. Let's just start with the optics on this. They throw a quote around. I don't know the proper context, so I'll ask you. They quote you as saying that you believe Medicaid and Medicare were mistakes. Do you believe that?
I reject the premise of the question, Chris. Those are talking points that came from an hour-and-a-half long podcast I did with Ezra Klein. As you and I know, we have these long-form conversations that go into depth, and I think we need more politicians who step outside of their scripted talking points. For anybody who's interested in my views on this, listen to that hour and a half of my conversation with Ezra Klein. It was actually good. I lean right, he leans left. We had a great conversation. But here's what I do believe, and I know, Chris, is that Medicaid waste, fraud, and abuse is real. And I'm not saying it's the only step to bringing down healthcare expenses, but I am saying it is the most uncontroversial step that both Republicans and Democrats ought to be able to. And even if you look at my home state of Ohio, you think about our Medicaid budget next year, it's looking like $47 billion. I think there's good evidence to suggest that up to 10% of that, it's a big number, about $4.7 billion, can be attributed to at least illegal waste, fraud, and abuse, or even forms of waste, fraud, and abuse that we would think about it in a colloquial sense. And my view is let's put that money back in your pockets to make healthcare more affordable in my state at a time when we need it. And let's change the incentives a little bit. Let the state keep most of those savings, because that's not what happens today. Today, most of the savings go to Washington, D.C. I say let's let states keep a majority of those savings, and that creates the proper incentives, whether you're a red state or, in principle, even a blue state, to tackle this waste, fraud, and abuse, to prosecute the bad guys, take that money, and use it to bring down copays, bring down health insurance premiums, pad those health savings accounts. That's common sense. And I do think, Chris, and talking to people in my state, I don't care whether you're on the left or right, this should be common sense, but it takes an actual executive to execute rather than just somebody making a political pandering point. So that's what I'm trying to do here.
I get it. And I get that you don't believe it's a mistake. It's about how it's run. But here, the job is to ask the question and have you answer it. However, a couple of concerns. Waste, fraud, and abuse is real. Anybody who says otherwise is pretending. However, often waste, fraud, and abuse is a guise, a canard to mask cutting of services. We've seen it many, many times in many different states. And how do you reassure people, especially in your state, you have almost 1 in 3, right? It's almost 30% of the state is affected by Medicaid in Ohio, that that's not what this is about?
Yeah, look, it's a fair point to raise, Chris. It's actually the opposite. The problem is we would risk running out of money if we don't ensure program integrity. So the only way to ensure the people who are actually supposed to be getting those payments, the single mother of 3 children in Appalachia, the father of 5 in Toledo, working hard to put maybe 2 jobs even to put dinner on the dinner table, the disabled veteran. Think about the person who may be in between jobs, a college graduate who may not have yet landed that first job, but soon will. People who temporarily need that hand up. In order to make sure the money is actually available to them, we have to prosecute the fraudsters. And we have good evidence on this. I understand some of your skepticism. But if you look at the Paragon Health Institute, independent group with an assessment of 1.1 trillion in effectively ineligible or wrongful payments over the course of a decade. That's over $100 billion on average per year. In Ohio, I'll give you a fact. Over that same decade, we've had enrollment in Medicaid only go up by about 100,000, from 2.9 million to 3 million. Yet over that same period, Medicaid spending ballooned from 27 billion to 47 billion. So that's not right. So again, I come back to
but that's not waste, fraud, and abuse.
Prosecute the fraud.
That's not waste, fraud, and abuse.
Just finish one point here.
Go ahead.
Well, a lot of it is waste, fraud, and abuse. I think about 10% of that is waste, fraud, and abuse. If you look at the Daily Wire's reporting,
I can tell you what 2 out of 3 of it
examples, that's what we're looking at. Yeah.
I got you. You're right about waste, fraud, and abuse. I'm not saying you're not. Nothing I should be saying should be taken to discount that you'd be better off if you can identify more of it. And I think you should be able to keep the money. It's a great argument to make because Medicaid gives you a little bit more leverage. Why? Because it's a partnership between federal and state. Yeah. You guys have to put up a lot of your own money also. I'm with all of that. However, 2 out of 3 of the dollars that are responsible for the increase in your rates, and not just Ohio, okay? I know it's true here in New York. Sure. The healthcare provider companies, that they have vertically integrated, and they've taken control of all the different cost centers. And they charge you guys whatever they want to charge. And long-term care, elder care for the disabled and home aides, they have spiked all the pricing on it. And you need help from the federal government, and I thought the president was going to get involved in this. Then we got distracted.
So let me say a couple things, Chris. You're making some decent points. Let me separate 2 issues, though. First of all, on that 1/3 that is owed to waste, fraud, and abuse, let's at least uncontroversially agree that we should go after that and go after it aggressively. And the fact that in some circles, even in my state, even with my opponent, that type of behavior is controversial is itself part of the problem. So at least we should agree we should go after the waste, fraud, and abuse. There we're on the same page.
I don't know who says don't go after it. I don't think it's a third.
Solution.
I think it's 10%. Oh, I don't think it's the only solution. I think it's 10%. I don't think it's a third. I think 2/3 are the healthcare companies.
10% is the number I gave you, right?
Yes.
Well, first of all, that 10%, let's just start there. That's $4.7 billion. That's big dollars in Ohio. However, there are other things we need to do.
Anyway.
You raised a good point on the over-bureaucratization of medicine, the over-corporatization of medicine. Medicine and the practice of medicine has become over-corporatized. My wife knows this. She's a physician who saves lives every day at the cancer hospital at Ohio State. And part of what caused this, I mean, this is a longer discussion than we have time for here, is actually Obamacare, which in many ways imposed a lot of administrative burdens, unforeseen consequences that created that vertical integration, that created a lot of that bureaucracy where physicians are spending more time completing the paperwork than they are taking care of patients. Now, to solve that, we have more work to do. I want to move to value-based care models, a healthcare system, including Medicaid, that pays not just for volume of healthcare. That should be yesterday's model, but pays for actual positive outcomes delivered to patients. That's harder work. That's a longer conversation, and I'm up for taking it on as governor. But the first step, Chris, and this is just the easiest step we should start with, is take 10% of that $47 billion in Ohio, put that back in the pockets of hardworking families, including the Medicaid recipients for whom the program was intended. But also, Chris, it's not just Medicaid. See, when Medicaid fraud exists, even at a 10% level, that bids up pricing to increase prices for people on commercial health insurance plans, elder Ohioans on Medicare, and even those who are uninsured. They pay more, too, from artificial pressure on demand. So to me, I believe I'm a pragmatist, right? I'm not a politician by background. I'm a business leader. I'm an entrepreneur. I believe in practical solutions. You're not going to solve all the world problems at once. Start with what you can solve and can solve quickly. And that's where prosecuting this fraud aggressively, going hard, really increasing penalties, and giving the state the incentive to do it allows me to make this a top priority in my first 6 months. I'll have 4 years as governor, but in the first 6 months, we can get this much done. And I think it can unite our state. It can bring down healthcare costs, bring more money to Ohio. And then we move on to those tougher healthcare challenges that you're also rightly bringing up. Value-based care models over just paying for volume. and eventually debureaucratizing and decorporatizing the practice of medicine by actually bringing down a lot of those administrative burdens that are downstream consequences of a lot of the federal overgrowth, including through Obamacare. So that's the way I see things.
Well,
but I like the fact that we're able to have a reasoned conversation about this.
Yeah, you got it. Nothing matters as much as this. I mean, in terms of people who are going to vote for you or against you, they care about this more than pretty much anything else that you can think of except their purchasing power, which is related to this as well. So good luck in the election. You're always welcome here to make the case. Good luck to you. Thanks for joining me tonight.
Thank you for having me. Appreciate it.
So Chris Cuomo was absolutely spot on, and I'm glad he held his ground in that conversation, because here is what you need to understand about waste, fraud, and abuse. Nobody, and I mean nobody, is saying fraud should be ignored. Nobody is sitting here defending people who steal from Medicaid. That is not the argument. The argument is that MAGA has turned waste, fraud, and abuse into a political weapon. It is a phrase designed to conjure up a very specific image in your mind of a very specific type of person gaming the system. And we all know what image they are trying to paint. This is the same playbook Ronald Reagan ran in the 1980s with the welfare queen narrative. Different decade, same trick. And here is the part that exposes the whole thing. Vivek Ramaswamy himself admitted on live television that waste, fraud, and abuse accounts for roughly 10% of the problem. 10%. Chris Cuomo told him that 2/3 of the cost increase is coming from vertically integrated healthcare corporations that have taken over every single cost center in the system. Hospitals, pharmacies, insurance, billing, all of it under the same roof. All of it charging whatever they want. And what did Vivek have to say about those corporations? Practically nothing, because those corporations are his donors. That is why they will go after the single mother in Appalachia who may have had a billing error on her Medicaid claim before they ever go after the CEO of a major healthcare company committing systematic fraud worth billions of dollars. And since we are talking about healthcare fraud, let us talk about Rick Scott. This is a man who was the CEO of a health insurance company that was hit with the largest Medicare and Medicaid fraud. Settlement in the history of the United States, $1.7 billion. He did not go to prison. He became a United States Senator. That is who these people actually protect. That is where their real loyalty sits. Not with the Medicaid recipient who needs help. With the billionaire executive who defrauded the program at a scale that dwarfs anything any individual recipient could ever do. Now here is what Vivek and every other MAGA politician will never bring up on any of these shows. Medicare for all. Studies consistently show that a Medicare for all system could reduce total U.S. healthcare spending by somewhere between $450 billion and $650 billion every single year. The reason is simple. The United States currently spends over $800 billion on health insurance, bureaucracy alone. The administrative overhead, the billing complexity, the layers of private intermediaries between a doctor and a patient, all of that goes away under a single-payer system. And with the government negotiating the prices directly, drug costs and provider rates come down significantly. But Vivek will not touch that conversation. Trump will not touch that conversation. None of them will, because the health insurance industry spends enormous amounts of money making sure that conversation never gets serious traction in Washington. So when you hear waste, fraud, and abuse, understand what is actually being said. They're not going after the 90% of the problem. They're going after the 10% in a way that lets them justify cutting services to the people who need them most while leaving the corporations that are driving up costs completely untouched. That is not healthcare reform. That is a dressed up excuse to gut Medicaid and hand the savings back to the people who were already taking too much in the first place. I would love to see Bernie Sanders sit across from Vivek Ramaswamy and have this exact conversation, because that is the debate that would actually tell you everything about whose side these people are really on. Drop your thoughts in the comments below, hit the thumbs up, subscribe, and turn on the bell notification. I will see you in the next one.